Firstly, a little bit about me and my story. In 2004, I had my first epileptic seizure. It was the first of a number of nighttime seizures over a period of a few years. They didn't particularly affect my everyday life, and I thought that I'd probably grown out of them. Then, in April 2010, I suffered a major daytime seizure, which led to a blue light ambulance trip to A&E, a night in intensive care, and a week at St George's Tooting. I was monitored day and night and had a number of tests during a very difficult time for me and my family. I left with a new diagnosis, daily and emergency medication, and my parents were given CPR training. Over the next 2 years, I had a number of seizures which required changes in my medication. Throughout this turbulent time, I had numerous appointments and phone calls with my consultant paediatrician, as well as frequent conversations with my GP, school nurses, school pupil welfare officers and teaching staff. There would be constant meetings with these people every time something changed in terms of my medication, symptoms and my seizures themselves. At these meetings, every detail of every seizure, some of which still haunt me to this day, would be discussed. This was frustrating and sometimes distressing. That is one of the main reasons why this epilepsy passport is such an amazing idea. If used by all young people with this condition, it will save doctors, paramedics, and even parents and carers valuable time trying to find out and communicating a person's seizure history. All of the information will be clear, up to date, and succinct, as well as being easy to understand by all, be they NHS staff or members of the public. Parents and young people will feel less anxious in meetings knowing they don't have to relive every horrible moment of every horrible seizure. It would also mean that a young person with epilepsy can have more of a normal teenage lifestyle. Going to the cinema or being out with your friends has an added element of risk, when you never know if you might wake up in an ambulance or in hospital. Carrying the epilepsy passport would provide a bit of a safety net, giving parents a sense of security and the young person a bit of extra freedom. I know many other children and young people like myself would really benefit from this wonderful passport, particularly in an emergency situation. I myself have had a few seizures in public, and although I was lucky enough to have friends or family around to help me, under different circumstances it would provide the essential information for whoever is in the right place at the right time. I believe that a product like this has the potential to save lives. My parents recorded details of my epilepsy in a document which they updated every time I had a seizure or there was a change in my medication. They would give this to whoever was looking after me in case of emergency. The passport would have been much more convenient than carrying 8 pages of A4 paper stapled together. This time in 2 years, I will hopefully have just started studying at university. The epilepsy passport would bring peace of mind to me and my family in any transition of care. One last thing about me and my story. This week I celebrated 1,000 days seizure free, so hopefully I'll be allowed to start driving lessons in a few months' time. Thank you very much.